Good morning to you, Mom. I am Jason Batlag Pedras, and today we are going to discuss about the health geography. Health geography is a field that explores spatial patterns, determinants of health, and disease. It examines how factors like location, environment, and social conditions interact health outcomes or influence health outcomes. One best example for that is during COVID-19 pandemic, where health geographers studied the spread of diseases. By mapping the location of outbreaks, it helps them to understand how virus spread across region. That example highlights the importance of health geography. It helps us to understand how environmental, social, and economic factors interact to affect health. This also provide insights for better healthcare planning and disease prevention strategies. So now let's proceed to the key components of the health geography.
There are key components of health geography. The first one is disease ecology. What is disease ecology? So it studies how diseases are distributed across different geographic areas and the factor that influence their spread. So disease ecology is the study of how ecological interactions and environmental factors influence the distribution, transmission, and dynamics of diseases within populations and ecosystems. It focuses on understanding the relationships such as humans, animals, or plants. Even the pathogens like bacteria, viruses, or parasites and their environment. So this field integrates concepts from biology, epidemiology, and ecology to address issues like the environmental changes like deforestation, climate change, affect disease outbreaks, or how biodiversity impacts disease transmission. So there are some examples of disease ecology. So the first one is the Lyme disease. So this relationship between deer tick and humans influenced by forest fragmentation and biodiversity loss, which increases tick populations and disease risk. And the second one is the malaria. So this disease is spread of malaria is shaped by interactions between humans, mosquitoes, and environmental factors like water sources and climate change. So the last one is the COVID-19. So this COVID-19 fundamentally altered our world during the pandemic. So the role of human activities such as wildlife trade and urbanization and facilitating zoonotic spillover from animals to humans. So examples ani is katong pandemic. Our place is not nagisakop na jud siya sa virus which is the COVID-19. So there are some people who died on this disease. It's because the findings nagkuhan siya through nig magpa-check up iingon din sa doktor na you have a COVID-19 virus but gilantan na ta or even giubo giignan na din tag COVID-19 na din atong sakit. So three examples that I'd mentioned, the Lyme disease, the malaria, and the COVID-19 illustrate how ecological and environmental factors influence disease dynamics. So why is it important that the disease ecology? It is important because it helps us understand the complex interactions between hosts, the pathogens, and the environment.
What is access to healthcare? Access to healthcare refers to the ability of individuals to obtain timely and appropriate medical services. It factors such as the ability of healthcare providers, affordability of services, physical accessibility, and the quality of care provided. Ensuring access to healthcare is essential for improving health outcomes and reducing health disparity. So when we say access to healthcare, means having the ability to get medical care you need when you need it. This includes being able to afford it, getting to a healthcare facility, and having the service available. It's important for good high health quality of life and social equity. So access to healthcare is just only having the ability to get the medical care. Also, give us the foundations to being healthy and avoid those diseases. So healthcare is incredibly important for a number of reasons. First, as healthy, of course. Healthcare helps prevent, diagnose, and treat illness and injuries. It allows us to live longer, healthier lives, and reduce the risk of serious health complications. Second, it improves our quality of life. Healthcare gives us the ability to manage chronic conditions, maintain our physical and mental well-being. Lastly, it helps us live longer, of course. Healthcare advancements have significantly increased life expectancy. We're living longer, healthier lives thanks to medical breakthrough and access to preventive care. So only one thing I could say is that prevention is better than cure. So be safe. Thank you.
Morning, Mom. I'm Regan, and I will be discussing about the environmental influences on health. Environmental influences on health. So the environment has a direct impact on health. Factors such as air, water, soil, and living conditions shape the quality of life and health outcomes. So first is air quality. So link between air pollution and respiratory diseases. Example given like asthma and lung cancer. First one is air quality. So polluted air coming from vehicles, burning plastics or burning fuels, smoke from their factory can cause breathing problems like asthma or even more severe like lung cancer. The second one is water and sanitation, like contaminated water leading to diseases like cholera and diarrhea. Drinking or using contaminated water can lead to illnesses like cholera and diarrhea, especially where sanitation systems are poor. So example, communities without access to clean water experience higher rates of waterborne diseases. Third one is soil and land use. So chemicals like pesticides and industrial waste can pollute the soil, so affecting the crops and leading to potential health risks when consumed. So example is overuse of agricultural chemicals can result in harmful effect for both farmers and the consumers. The fourth one is urbanization and industrialization. So rapid growth in cities and industrial activities can create issues like overcrowding, poor waste management, and exposure to harmful substances, so impacting both the mental and the physical health of individual or the people living in that area. So example is urban areas with poor waste disposal systems often see an increase in disease outbreaks. Environmental factors plays a crucial role in shaping health outcomes. So addressing air pollution, improving access to clean water and sanitation, and the negative effects of urbanization are essential for creating healthier communities. So sustainable environmental practices and policies can significantly reduce health risks and improve overall well-being.
Spatial patterns of health and illness diseases distribution. This section explores the spatial patterns of health and illness, specifically focusing on the mapping of endemic, epidemic, and pandemic diseases. These patterns reveal how diseases are distributed across geographic areas, providing valuable insights for public health interventions prevention and diseases control efforts. Mapping endemic, epidemic, and pandemic diseases. Endemic diseases are those that are constantly present in a particular geographic region or population. Epidemic diseases occur when there is a sudden increase in the number of cases of a disease in a specific area. So, pandemics are epidemics that have spread to multiple countries or continents, affecting a large number of people. Mapping these different type of diseases help us understand their distribution and identify area addressed. For example, mapping malaria reveals its prevalence in tropical zones, where the mosquito vectors that transmit the disease thrive. So, similarly, mapping COVID-19 hotspot during the pandemic provided crucial information for public health officials to implement target intervention and control the spread of the virus.
So, hello everyone, I am Nele Okato. So, my task is about policy and planning in healthcare geography. So, the first one is role of geography in healthcare system. So, geography significantly influences healthcare system by impacting access to healthcare services, health outcomes, and resource allocations. So, think of like this where. So, where you live can affect how easily you get healthcare fundings area and receivers. So the example of role of geography in healthcare system is the example contrast healthcare access in a remote Philippines village with that of a city. So the village limited access to doctors, hospitals, and medicine result in proper health outcomes compared to the cities ready available healthcare facilities and specialists. So this highlights how geographic location directly impacts health access and outcomes. So the second one is urban planning for healthy space. So it's about designing cities that promotes health and well-being. It involves creating walkable neighborhoods, parks, and green spaces, and encouraging active transportation and ensuring access to healthy foods and options. So, the goal is to build environmental that support healthy lifestyles and reduce health risk.
Good morning, ma'am. I am Mary Grace Simobeda. In health and place, there are two types that we need to consider. First, the physical environment and well-being. The second is cultural and social practice. Physical environment and well-being, the importance of green space and green environment for mental and physical health are interconnected aspects crucial for quality of life and enhance overall well-being, ultimately contributing to improved health, happiness, and success. Cultural and social practice, the role of traditions, diet, and lifestyle in outcomes. Cultural and social practice encompasses the costumes, traditions, values, and belief are transmitted within communities, shaping individual and collective identity. That's all. Thank you.